the US added $12 trillion in debt since 2020. To put that in perspective, we can go all the way back from 1800 to 2020, and it took 221 years for the total US debt to reach $12 trillion. This entire history was done just since 2020. The problem that was already a big problem blew up. Like wildfire, it spread uncontrollably. Now, most people, they see that and they hear it and they hear everybody saying, this is a problem, it's too much. But they really don't understand why. They don't understand how it's affecting or what it's doing to the economy. So right here we have the federal government and their workforce, which is employed and paid for by taxpayers. All of these states, roughly 34 of them, have a workforce that is less than the federal government. Now, it's also important to know that all of these states balanced their budgets, in fact, had a surplus. But the federal government alone on workforce is the largest employer in the United States. The economy is predicated on the US government at this point. It's created two different realities that was no more evident in the latest election. Because on one hand, we see numbers like, oh, the workforce is growing and the GDP is growing. The problem was, in 2024, almost 50% of all new hires, those new employed, were from the government. That was in our workforce numbers. Now, the other problem is, almost 50% of the total GDP was government expenditures. When you start taking those things out, the economy doesn't look so good. As in, the economy has become more and more the US government. And it takes a lot of money to fund that kind of growth. But it's not just money. So we're walking through the problem. I'm going to walk through how it works and then detail how it affects you. Now, as far as administration of the public, the economy, and other aspects of our lives that it takes just for a country to function, we need a government to obviously set regulations and do all of those things that we all need. The problem becomes is how it's administered, especially the changes in America. You see, after the 1960s, America had a hard time creating regulations as well as making sure people abided by them through the administration that it currently had. We had rules called the Chevron laws. And effectively what had happened was we began to rule by departments. So the federal government had administrations as well as departments actually create the regulation and the enforcement of it. They did this on a practical standpoint to simply help administer it. Well, this grew and grew and grew, where as departments went, it got further away from our elected officials. And they began to create regulations and enforce them, completely separate from those that were voted in by its citizens. This became its own beast that was self-perpetuating. Now, this added lots of complexity. How much? Well, you can see since the early 1960s, the amount of total code of federal regulations that were published. It exploded after this point. Now, complexity doesn't necessarily mean it's a bad thing, but when applied, especially due to regulation in an ever-changing landscape, it can be astronomically detrimental. We can see how complexity can completely destroy industries in reducing the overall benefit while increasing the cost by looking at just one industry alone. Healthcare in the United States is pretty dysfunctional. Everyone knows that. The complexity is wild. Now, the interesting thing is that overall healthcare, if you can get access and afford to it, the results are good. But trying to get the access to it is very difficult. We can see that since the 1970s, administration growth for healthcare systems has gone up so far disproportionately compared to physician growth. As in, hospitals today are basically, and healthcare in general, massive administrative organizations, with the resources being poured into outcome are relatively small. And we can see how that has affected the United States. When we go back, take a look. 1970 to 1975, just like we saw in that chart, as it started to grow, the United States actually kept up with all other countries. But by 1975, right when we saw a very large spike, so if you remember, right here we go into the 80s, right before the 90s it began to take off. That is this period right here, right before healthcare dramatically changed in the United States. And we can see it cost much, much more, even though our life expectancy has not kept up with the other countries. Basically, in the United States, healthcare has gotten more expensive, yet we have not seen the same benefit. This follows exactly how much administration had been built up and spent over outcome, which makes sense. The administrative levels that we all have to pay for are not tied to outcome. This actually makes it more difficult for people to get access. So why the output is good if you can afford it and if you can navigate it, that's great. If you can't though, you don't get those benefits. So the system stops working for the people it's trying to serve. Another perfect example of this is within the school system. Once the U.S. Department of Education, based in Washington, D.C., a federal organization, got involved, we saw an explosion from 1950 to 2009 in administration and other staff. Over a 700% increase, while students only grew not even 100%. Teachers only grew by 252%. Administration and other staff wildly outpaced the growth of students and teachers. Once again, separating the machine from the outcome or the people that it serves. Now, these are just a couple of examples, not stating bad or good, but definitely to show how outcomes are affected by complexity.